All right, good morning, everybody. Good morning. My name's Mike Minahan. I'm a captain with the East Long Fire Department. Today we're going to be going over compression-only CPR. So this isn't a certification class. I just want to put that out there. This is very much an informative class on how to do CPR by just doing chest compressions. So a couple things before we start. There is 2 exits here if you need to evacuate the room quickly. Just meet out in the parking lot. Restrooms are across the way. Just watch out. There's a pretty crazy game going on out there of, what is it? Beanbag baseball. So don't get in their way. So a little bit about myself. I'm a captain paramedic with the East Long Fire Department. We run medicals, fires, unit. We're kind of an all hazards organization. I'm assuming everybody's somewhat from around here, East Long Meadow. Anybody not from East Long Meadow? All right, the door's right there if you guys want. I'm just kidding. So thank you for coming. I appreciate everybody. It's actually a big group when Alicia and I want to thank Alicia in the back for setting this up. So yeah, she's like, no, please stop, please stop. So when Alicia and I talked, we weren't sure what type of reception this would get. So I'm glad, what do we have, 22 people-ish? 27, a couple of you guys snuck in, so we'll get your names later. So thank you for coming. CPR is, unfortunately, it happens a lot. So what this class is going to teach you is just real quick things so you can help in a situation where someone does go into cardiac arrest. And the biggest thing that we want to get out of this very short course is do something. Something is better than nothing, all right? When you call 911, even if you're unsure of what to do, we have awesome dispatchers, not only in East Long Meadow, but in Wilbraham and wherever else everybody's from. They're going to talk you through how to do CPR. What I'm going to add in today is just some of the mechanics of what we need you to do. So when we show up, we can bring this person back to life. All right. This could be a loved one at home. This could be someone playing beanbag baseball right out there. It knows no age group. We go from very brand new newborns to elderly people in their late 90s to early 100s. So everywhere in between, people go into cardiac arrest for multiple reasons. And doing chest compressions is the one thing that's going to keep them alive enough for us to come in and hopefully bring them back to life and have them thank you guys at some point for helping. All right. Normally we like to do CPR on the ground, but because of space and I got bad knees too, we'll train on the table. We'll go through the mechanics of everything. And if anybody wants to later on, we can put it on the floor and practice down there. When we do go practice after the video, we'll have whoever's not at a table, and I don't have one for you guys in the back, we can just surround the table. We're all going to get some practice and go through it. All right? Any questions before we play the video? Awesome.
A cardiac emergency can happen anywhere. Be prepared with a simple technique known as compression-only CPR. You can learn it in minutes, it's easy to remember, and it can help save a life. If someone suddenly collapses, check the scene for safety. Then, check to see if the person responds to you using the shout, tap, shout technique. At the same time, check for breathing, life-threatening bleeding, or another life-threatening condition. Are you okay? Are you okay? If at any time you determine the person is experiencing a life-threatening emergency, call 911 and get the first aid kit and AED or tell someone to do so. Anna, call 911 and get the first aid kit and AED. Then, if they are unresponsive and not breathing or only gasping, begin compression-only CPR. First, ensure that the person is on their back on a firm, flat surface, such as the ground. If they are lying on a bed or couch, carefully move them to the floor. Next, kneel beside them like this with your knees near the person's body and spread about shoulder width apart. Place the heel of one hand in the center of their chest with your other hand on top. Now, interlace your fingers and make sure they are up off the chest. Then, position your body so that your shoulders are directly over your hands. Lock your elbows to keep your arms straight. This technique allows you to use your body weight to help compress the chest. You are now in the correct position to give compressions. When giving compressions, push hard and fast. Compress the chest to a depth of at least 2 inches and a rate of between 100 and 120 compressions per minute, or about 1 every half second. After each compression, let the chest return to its normal position. Watch as I demonstrate just a few chest compressions so you can see what they look like. 1 and 2 and 3 and 4 and 5 and 6 and 7 and 8 and 9 and 10. Finally, keep going. Continue giving compressions until you notice an obvious sign of life, like breathing, an AED is ready, a trained responder is available to take over compressions, EMS personnel arrive and begin their care of the person, you are alone and too tired to continue, or the scene becomes unsafe. If you would like to learn how to give full CPR and use an AED, you can take an American Red Cross CPR AED course. Check out redcross.org for more information.
All right, so like I said, very short video on how to do CPR. And what you saw is everything you need to know how to do, and we're gonna practice the hands-on portion. Before we begin, any questions from the video? Pretty simple, right? You see someone down, yeah, I'm getting a few smiles up front. If you see someone on the ground and they're not responsive and they're not answering your questions, they're not moving at all, go right into CPR. If you forget how to check for responsiveness and everything else, just do chest compressions. If they start waving their hands at you to tell you to stop, you know you check their responsiveness and they're responsive, right? That's the point to stop. So remember to call 911. The dispatchers on the other line, on the other end, will give you instructions on what to do if you forget. Know this, that in the background, they are calling emergency responders, police, fire, and EMS. Even though they're talking to you, someone next to them is calling us and we are responding. But we are minutes away, and the minutes make the big difference. All right, so immediate recognition, calling 911, and doing chest compressions is what's gonna save this person's life, okay?
Depending on the age, do you do less compression or less force if someone's older or if someone's like 100?
So we want to focus on is for the average adult, right? So the average, right, is it's a wide range of how big people are. It's about 2 inches depth for compressions, but that could range wildly from someone who's over 300 pounds to someone who's only 100 pounds. So adults have a very large range. Push hard and fast and as hard as you can go. Obviously, you don't want to touch the floor through their body. So gauge it on how big the person is, how frail they are. But I promise you, unless if you're a bodybuilder and the person weighs under 100 pounds, you're probably not going to hurt them because clinically they are dead. We are trying to get them to the point where we can bring them back. Don't worry, you're not going to break ribs. That's a common misconception. You're actually separating cartilage with the ribs. So if you hear that cracking sound, that's a good sound. That means you're going deep enough. Don't worry about it. And even if you do break a rib, if it does happen, when the person wakes up, that's the least of their worries, all right? Because they are clinically dead. We have to do something so we can bring them back. All right? Yes?
They may not be responsive, but maybe they're still breathing.
Yes, so if you feel comfortable, and this is where, this is on your comfort level, if you feel comfortable checking for breaths and a pulse, please do so. The problem is if I ask everybody in this room right now to check for their pulse, they know exactly where to go. And we're not gonna do it, but if I said check the neighbor's pulse, how long do you think it would be before you find their pulse? Now add adrenaline to that, because now you're trying to save someone's life. It is very difficult, even for first responders, to check for a pulse. We all do it, and we do it in different areas, femoral pulses, radial, brachial, carotid. We check everything, but that's what we're trained to do. For a non-trained person, it's very difficult to check for someone's pulse. And what are we not doing while we're doing that? Chest compressions, all right? Yes?
Could you show exactly where on the chest that you should be?
Yep, I'm gonna show you that, and then we're gonna all practice, all right? Any other questions before we begin?
So is breathing into their mouths no longer done?
Yeah, we're gonna hold off on that for many reasons. One, most of the time you guys, does anybody have a pocket mask in their pocket? So a lot of people don't carry some sort of barrier device, and we don't wanna spread diseases. Everybody was alive during COVID, right? So let's try to avoid that. And what we're doing by doing breaths, what are we not doing? Chest compressions. And chest compressions, this is what I want everybody to walk out today with, is chest compressions is the one thing keeping this person in a stable enough condition for us to bring them back, or the doctors at the hospital, or even you guys. If you're giving breaths, you're not doing compressions. And if they have a bad airway, meaning something got stuck in there and you're just trying to give them breaths, we're not doing chest compressions at the same time. So we're gonna hold off on doing breaths. We're gonna do just chest compressions. And then when help arrives, whether it's an EMT, a paramedic, a doctor around the corner, they will focus on other things and providing breaths at a later point. All right, good question though. Yes, in the back.
So, the rhythm that she was using is a 1 and 2 and 3, is that the rhythm we should be using?
Yep, a continuous motion, up, down, up, down, up, down. If you want to, in your head or out loud, staying alive. The beat to staying alive is a good one. There's a bunch of them. Anybody ever heard of Baby Shark? Grandkids, kids. If you sing it, it's going to be stuck in your head all day, but that's also the same beat. So if you want to sing that out loud, if that helps you, in the end, you're saving a life, or trying to at least. So, but like she said, 1 and 2 and 3, it's a continuous up and down. It's not a push, stop and think, push, stop and think. Okay? Any other questions? Yes.
What happens if you have nobody around, you got to call 911? What are you supposed to do if you're the only person around?
Awesome question. Anybody not have a cell phone?
Yes.
You don't have a cell phone?
No. You have several.
So can we all agree we all have cell phones nowadays? This young generation, you know? I'm just kidding. What we can do on our cell phone is call 911, put it on speakerphone, put it right in front of us. We can start doing chest compressions. While on speaker, the 911 dispatcher can give us instructions and call for help. Can we all agree that's probably something we can all probably do? Excellent. About 10 years ago, that was kind of the introduction to, put your phone on speaker and call 911. And, a lot of people didn't have cell phones as much as we do now. Pretty soon, they'll just be built into our ears just for convenience. And they'll already know, 911 will already be called the second we see something happen. So does that answer your question? Awesome. Yes?
Anatomically, you're just basically pushing the blood through the arteries?
Yeah, so we're compressing the heart. The heart is a pump. We have to move the blood through the body. If someone is talking to you and they go unresponsive, they're still breathing until they go down. That oxygen is still in their lungs. So if we pump that heart, we're moving the blood through the lungs because it goes into the heart, through the lungs, back into the heart and out to the body. And you're oxygenating all the good stuff. The most important is your brain and then reoxygenating your heart. So as long as you're doing chest compressions, it's like the body's still functioning, and then we'll work on the electrical portion and everything else afterwards. Does that answer your question?
Yeah, no, that's wonderful.
Anything else before we begin? Awesome. All right, so I have the average adult up here, right? This looks pretty average, right? But this is the mannequin that we're going to use. There's a couple different variations I have here. This one, and then there's the darker, lighter, tannish, beige ones over there. They're the same type of mannequins. They do have lights on them to tell us if we're going deep enough and fast enough. I don't want you to worry about the lights because there's not lights on people, unfortunately. So we can't use that for a reference. On this mannequin, you have to be able to visualize the chest. So we have to expose our patients. Again, just remember, this is someone's loved one that is dying. So any exposure we have to do, we try to keep it as minimal as possible, but we have to expose skin so we can do good compressions and later on add in the AED. All right? On this person, we're going to visualize the chest by seeing it. We're going to look for their clavicles. Everybody know where their clavicle is? Awesome. And then we're going to go down to the sternum. So for those of us that have a little belly, it's right above our belly, just for simple terms and points. We're going to go from here to here. That's our chest. And we're going to find the halfway point down. And that's where we're going to place the top of our hand, and the bottom of our hand will just go below it. So that's the lower portion of the chest, the lower half. All right? We're going to take the hard part of our hand. That's going to go right in the center. So on my mannequin, I'm going to place it right about here. Can everybody see that? Excellent. When I'm doing compressions, I'm not going to do it too hard on this table because I may push right through it. I'm going to take one hand, I'm going to place it on the lower half of the chest like I just showed you. And I'm going to take my other hand. You can interlock your fingers if you want. I personally don't like to, so it's up to you. Place the other hand right on top. You're going to lock out your elbows. We don't want to use muscle, because if you're doing this, you're using your muscles, and you're going to get tired really quickly. You want to lock out your arms the best you can. Place it in the center of the chest. and get your body right over them. In the video, she said, get your knees right up close to the patient. That's a good point. Get up as close as you can. Obviously, there's no arms here, so it'd probably be a couple more inches farther away. But I like to get right over the patient. So now instead of me pushing, I'm actually dropping my body down. All right, does that make sense? And we'll get to practice, and everybody will get a chance to practice on the dummies. And then it's just up and down. All right? Now, obviously, like I said earlier, if we don't want to do it on a table, on a bed if we can, but there are going to be times where you may not be able to physically drag this patient off of that surface. So in those very rare times, just do compressions where you are. All right. We'll eventually, when we show up at the ambulance service, the fire service, the police, we'll get them on the floor. But if it takes you 5 minutes to get this patient off the bed and then they're just going to slam down to the ground anyway, what are we not doing? Chest compressions, right? So little chest compressions are better than no chest compressions. We'll just go down that route. All right. Any questions before we begin?
No, I just have one.
Go ahead.
I notice you're going from the side. You don't ever go upwards. You go sideways.
Most of the time, almost all of the time. There are going to be times. So anybody have a bed that's very close to a wall? Some people, maybe. We find patients never fall where we want them to fall. It's just a fact of life, right? We try to move them to a better place, but there are times where we have to work wherever they are because they're stuck and it's going to take us too long to get them. So if we have to get over them and do it this way, absolutely, we'll do it this way. And it may end up being this way as well. It's not convenient, but it's better than nothing. All right. But ideally, you're going to set up on one side or the other. It doesn't matter. We're ambidextrous. Chest compression this way is the same as a chest compression this way. Okay. And there was another question up here.
The center or on the side?
What's that?
Will you push it down?
We're going to push straight down.
On the center? The chest.
Oh, in the center. Yep. So you're going to find the center of the chest right here. The palm of your hand is going to be placed there. So your hand's going to sit towards the side, but it's the palm of your hand, which is the hardest part of your hand, is going to be there. Okay. All right? Okay. So everybody, oh, one more question. Go ahead. Yeah, because most people, especially, and this is a very short class, if you walk out of here, you're not a doctor. I wish it was that easy. But checking for a pulse is very difficult. Somebody may not have a radial pulse, but they could have a carotid pulse. So some people are checking down here. They don't know how to check up here. And again, if I asked everybody to check their partner's pulse, how long do you think it'll take to find it? And with that adrenaline rush, as you're checking for a pulse, you're going to feel your own pulse sometimes and think they have one. And we're not doing what? Chest compressions. Good job. Everybody's going to walk out of here and say, man, I said chest compressions like 300 times today. So if you feel comfortable, do so. But again, remember, time is ticking. All right? So if you don't have a mannequin in front of you, I'm going to put one here. Just move up to a table that has one, and then we'll all rotate, and we'll just keep practicing. I'm going to walk around and check everybody, okay? Excellent. Straight as possible. There you go. Now get your shoulders forward more. So let's move this here. And now push down. A little harder. Good. So lock your arms out to the point where they're straight. Yeah. Now, yep. Now go up and down. Go a little bit deeper. There you go. Good job. Do a couple more, and I'll be back. Oh, perfect. Yeah, that's fine. Perfect.
Your light's on.
Mike, is it right on the sternum?
Yep, you're pushing right on the sternum.
Okay.
Go ahead. And lock those elbows out so you don't get tired. Perfect. Good speed, good rate, and you got a green light.
I'm still going.
Let's move your hands up. So if this is their chest, this is going to be the lower half between my fingers. So let's put our hand right there.
Here.
Perfect. Lock those hands up. Lock those elbows out. There you go. Let's bring it a little closer. Now try. A little deeper. Push all your weight in. Keep going. A little deeper. A little deeper. Excellent. And then just keep doing that until help arrives. That easy, right? Let's bring this part of your hand forward a little bit more. Bring this closer to you so it's easier. Bring your shoulders forward more. Lock your elbows out, and now push down hard. A little harder. Move that way just a smidge. There you go. Now go. A little harder. Excellent. And then just keep doing that. Sing the song in your head if you want to say Baby Shark. Yeah, right? All right. How are we doing? Yes.
You're alone, you don't have anyone to call 911.
Do you have a phone in your pocket? Call 911, put it on speaker, and then do chest compressions.
Can you show us again?
Absolutely.
I'm thinking I should be here.
So if this is the chest, so we're going to use this little notch right here, right? Yep. If this is the chest, this is going to be the lower half. I'm going to place my hand here,
Okay, so here's a mark.
and I'm going to go up and down. All right, give it a whirl. And then I got a green light, so I did good.
Wow, I don't think I
Practice today. Bring your hands a little bit more towards me. Let's put it right in front of you, too. Yep. Now, lock those elbows out. Now, push hard, push hard. Excellent. A little harder? Perfect.
Faster.
All right, keep practicing. I'll be back. Try to move your hands that way just a little bit more. Come towards me a little bit. Now get right over them. I know it's a little high.
I'm on my toes.
Yeah, right? Now push down as hard as you can. A little deeper. Excellent. Keep going. And you guys can swap out. Yes.
Baby.
Yes.
So, same position.
Well, remind me after
baby's
we
a
all
little-
practice, and I'll talk about it.
I
Okay?
know it can be a little different.
Yep, it is. And I'll talk about that when we get through it. Yes. Excellent. Bring it a little closer to you so you're pushing down straight. Yep. There you go. And try to get your shoulders more, like lean into it. Almost use them to balance. There you go. And then move your hand, put your hand right here.
Okay.
The palm of your hand. There you go. Yep.
Okay.
And then push straight down.
Now it's harder.
Now, is it supposed to be skin on skin or?
Oh, flip your hand over.
Oh, I'm doing it. You're consistent. I keep doing it the wrong way.
Bring your shoulders towards me.
And lock them.
Yep. Bring your shoulders towards me more. Keep your hands where they were. Put them back right there. Now bring your shoulders towards me. Now push down really hard.
Does this have a yellow light?
No, it's just green and red.
Now, did you say it's supposed to be skin on skin?
Ideally. I can do chest compressions over this, but eventually I'm going to put AED pads on. So if we can just get that out of the way and then start doing compressions, it's even better. And then just try not to, you're trying to use your hands, drop your shoulders down, like all your weight. Yeah. I'm going to go check on some other tables. I'll be back. There you go. And then go down just like another inch. Right there. Perfect. Yeah, you're pretty much right on that notch right there. Yep. There you go. And don't worry about the lights. Oh, look at you guys, overachievers. Show me again.
I couldn't do it.
No, I'm going to help you through it, right? So go ahead and put your hand, yep. Put the hardest part of your hand, which is right here. Go forward a little bit more. And then go that way just a little bit. Lock your elbows out, which means just making them straight. So when you push down, your arms aren't bending. Bring your shoulders towards my hand. Now do it. And push as hard as you can. Move that way just a little bit. All right, now try. A little deeper. All your weight. There you go. Oh, you got one light. All right, let's switch out. Any questions while I'm over here? Oh, you guys already gone through? Everybody did good?
Yeah. Just above the.
So you know that divot? So that's your xiphoid process, but it's the lower portion of your sternum. So you want to go right above that. You remember the old blowers that you would blow into like a fireplace? It's kind of like that. You're pressing down, and in between that is the heart. So you're compressing the heart to pump blood through the body.
Let me give it a whirl here. Sure.
Oh, I hear some good clicking over here. Oh, we got a superstar.
She's good.
I'm gonna have her teach the class. How we doing?
Well, my light isn't going on.
Let's. So you're still. So this is what you're doing. You're going like that. Lock those elbows out and watch my body. Watch my shoulders. Ready? I'm dropping my whole body into it. All right. I'm a little heavier than you, but drop my whole body. I'm not bending my elbows. I'm not doing this because you're gonna get tired doing this. But when I do this, I just drop my whole body down. All 100 pounds of me.
Yeah, the AEDs give you instructions on how to do
Yes.
it well.
Yep. There you go. A little bit more. So you're still bending your elbows. Don't bend your elbows. Yep. And then push your shoulders through the table.
Oh, did I break your thing?
So place your palm right here. There you go. Put your other hand over. Lock those elbows. You know what I mean? So when I go up and down, my elbows don't bend. That's what you want to do. A little harder. A little harder. You're almost there.
Am I not strong?
But you know what? It's better than nothing. All right?
Oh, really?
No, you're doing good. Some people, it's just, you're not a big person, so you don't have a lot of weight to push through. Do you want to try it on the ground?
Harder. Would that work maybe on the
Yeah,
ground?
let's give it a whirl.
I'm just a little discouraged that I haven't
No,
got
no
the
worries.
in a while.
How'd everybody do?
Well, we're all worried that we're in the right spot.
I got it right
You're in the right spot. And don't worry about the lights. That's just
No,
more
but
of just
we're
an
just-
indicator. There you go, look at it. It's actually easier on the floor, but some people have
that's
trouble
what
with
I'm
their
saying.
knees.
I was too short to do it there.
Yeah, I have that problem too.
So hopefully he's not on the bed.
So what? Oh, so right here?
No.
Lift your hand up. So I'm gonna place my palm right here.
Oh, right high, that high.
Yeah. These mannequins are a little shorter.
So it's right in, so
Yeah.
it's right there.
Yep.
Not here.
Nope. So move, place it there and place your other hand over. There you go.
No green though.
Don't worry about the lights.
It's a shame, it won't turn green.
But he's doing it correctly,
He is.
right?
This is so the rate's between 100 and 120 a minute. The lights really want you more towards 100,
I
but
want
that's
you to
fine.
save me.
Yeah. Perfect. Yeah. We'll
So
bring them
if
inside.
they're in their easy chair, you just do your best to, and you can't move them.
Always try to get them off, but if you can't, do something. Something is
I mean,
always
should
better
you
than
pull
nothing.
them down on the chair so that their chest
You
may
could.
not be off, but it's a little
You could,
bit, yeah.
and if you can get them to the floor, obviously the floor is better. A lot of people have been doing better on the floor, but I don't want anybody getting hurt today. So, yeah,
I'm
always.
just worried that you puncture, you break a rib and puncture the lung, but you can't do that with steroids.
You can, but it's rare. I mean, if you get a 300-pound bodybuilder trying to do an infant, yeah, you probably could, but it's very hard for someone to physically do that. Yeah,
The heart's basically located more towards the left.
yeah, it's right here. Yeah,
So why do you do the compressions right on
because
top?
that bone covers from here over, so it's still going to compress down. You remember the old fans that you would use to blow into like a fireplace? That's what you're doing. You're pressing down on it, and it's compressing the heart. So by pressing down on this bone, it's still compressing the heart. Because your heart sits right about here, and that bone covers it.
Okay.
All right? Good question, though. Sneak by it.
She's good. She's great.
She's going to be teaching the class.
We have a question.
Yes, what can I help you with?
When it's a child, you can't do that, right?
We're going to talk about that afterwards.
Oh, okay.
I'll add in the children and the
Yes,
infant
a lot of
portion.
people are grandchildren.
Yeah. How you guys doing? Good? Awesome. He's alive. We'll stand him up. That way we know. Excellent. Good job.
You going over an EED?
I'm not today, but I can probably do another class where we cover that. It's just the time to try to go over all that.
Okay.
We're just focusing on this because a lot of people don't have AEDs, so we could talk about that for days. And automatic external defibrillator or automated external defibrillator, where it pretty much does all the work for you. You just got to press a few buttons.
Like you see them sometimes on the wall in shopping centers.
Yeah, there's one here. A lot of places have them, but a lot of places don't have them. So a lot of people like the AED because they think it's going to solve all their problems. It's an additive to good chest compressions. It's like an AED is like trying to flush a toilet with no water in it. You got to prime that pump. You got to get blood flowing. Otherwise, fixing the electrical problem, which it doesn't do anything if you're not pumping that blood. So
So we would have to use that in combination with the...
yeah, that's more of the certification level course where we're adding in the AED along with chest compressions. So if you guys are ever interested, let me know. We can set something up. All right? No, thank you guys for coming. How'd you guys do? Good?
I did it, but now I can't get it to go on the
Okay.
light.
Do you want to try it on the floor or do you want to just keep it on the table?
Well, let me just show.
Yeah,
Am
absolutely.
I doing this in the right spot?
So move your hand there.
Okay, so I'm afraid I won't even get the hand in the right place.
Lock those elbows out. There you go. And drop the
Okay.
shoulders down. There you go. So you're almost pushing from your shoulders as opposed to your hands. There you go. It is harder on the table. Oh, you got the basics down. Good job. How'd you guys do? Good? Good. Excellent. Excellent.
Okay, I want to make sure I'm getting this right.
Okay.
I was going down here. Am I supposed to be between this part right here?
Yeah, so you want to go like right here.
Right, like that,
Yep.
between the two?
Yep.
Okay.
And then, there you go.
How do I know if I'm pressing and it won't light up?
So it's very hard to tell. but something is better than nothing. So that's going to be the goal of today, is doing something is better than doing
I would put my hand
nothing.
between the chest, right in the middle part. Then I'll go like that.
And it is hard to do on a table. Do you want to try it on the floor? I don't blame you. So you're probably with this table, you're probably not going to be able to.
I should wear turtleneck.
Yes, that's the humor.
And then just slow it down just a little bit, and then push a little harder.
So when we push it on, you want to real quick or just count by number?
Let me show you.
Okay.
So I'm gonna find my location, and when I push down,
Yeah.
Oh, you're pressing hard.
this is the rate. I have a little more weight behind me. This is the rate I want to go.
If only one person on there, and you put the tire,
You are gonna get tired.
you have keep it going.
Like that?
Yeah, and I'll talk about that when we're done. I'll go over like adrenaline and everything else.
Like that?
A little deeper. Push harder. There you go.
Wow, you really gotta have muscles.
Does that have a light on it?
I might
No,
have just.
he gave us a make-believe.
So this one doesn't have a light?
It does have lights. Someone lost the cover to it, so I put some duct tape on it.
What does, is a green
Yeah,
light
it
mean
might-
it's a
it-
good
Does it
one
work,
or a
the
bad
light?
one?
Yeah, the lights aren't working. On it.
Try.
So as long as you're over the chest, because I noticed that green lighted only when I brought it over towards the heart more. And
Don't worry about the lights. The lights goes by depth, rate, and it has to be perfect on those. So again, if we're doing compressions, it's better than nothing. A lot of people focus. Sometimes I don't even turn them on because people are focused on the lights so much, and they're not actually focusing on good compressions.
Right.
But yeah, it does. There's the clip in there. You have to be directly over it, and people are focusing so much on that they're not doing compressions.
Yes.
Go ahead. Perfect. And you can hear it too. You can hear the clicking noise.
Are you going to talk about the AED or no?
I'll talk about it in a little bit, but we don't have the time to go into it too much. Good job.
And you
All right.
don't do AED on the low pulse.
Say that again.
Like bradycardia, you don't use an AED to shock it back into
So
rhythm.
you guys would still apply the AED, but if they are in a bradycardic rhythm, the AED will not shock that.
Right.
It'll actually tell you to check a pulse because they have one.
Right.
But if they are that bad, it might just be a matter of time before they go into cardiac arrest. But yeah, it will shock a
And
few
the rest is
different
when
rhythms.
your heart stops.
Yeah, so if your heart's completely stopped, it won't shock it, but it'll recognize it. But if you're in what's called ventricular tachycardia, which is a very fast heart
yeah.
rate,
Oh, I know
and then
the-
ventricular fibrillation. So it's only gonna shock those two, but it'll recognize asystole, and then it'll recognize if they
So
have
the
a
machine has
pulse.
the intelligence not to go into
Yes.
give you a jolt.
Yes. Yeah, and the machine's gonna do all the work. The only thing you gotta do is press the button. So that's the one time where you gotta make that decision to do it.
Yeah.
Yeah.
So are you guys around the clock now in our town?
Yep, 24 hours a day.
It's good to know now our own ambulance service.
We have 2 of them, yeah.
2 ambulances?
We're probably eventually gonna have 3, yeah.
Yeah.
So we just keep
Glad you're
growing
there for
and
us.
more calls, you know?
We're out in the woods somewhere and we're calling. We have to keep doing that until someone gets there.
Yeah, or until you just can't
So
physically
then we'd
do
have
it
to
anymore.
just, if you got tired, have someone quickly come in and sub.
Yeah. So if there was 2 of you, you would do it until you're tired, switch over, take a break, and then just keep going.
And just keep going until someone gets
Yeah.
there.
It's just, I'm gonna make it free if
Don't worry about the lights.
She wants to light on.
I know. Try it on the floor if you can't.
I
Oh,
got
you
it
did
on-
do it on the floor.
I did maybe
So
I'm getting too tall.
you're not tall enough. That's the problem.
Oh, is
So
that what it
we're not
is?
going to do it on a table. Even at the hospital, we lower the beds down because it is harder to do it up high. But you did it on the floor, which is where you would normally do it. So
Okay,
you did do it right.
I did. Okay,
Perfect.
thanks.
Yes.
Going like this, right?
Yep.
She's got her hands over the.
Because see how my hand, the hardest part of my hand is on the center. My hand just happens to go
Oh,
over.
you put it over.
It could be wherever it falls. I mean, we're not worried about modesty or any of that. It
How about a lady?
doesn't matter. She's gonna die if I don't do it. So
Want to keep it alive?
I know.
So you can still have your hand over there.
Wherever it falls is where it falls, and we have to.
I
Yeah.
thought it had to be up in the air.
Nope. Nope.
Oh, okay, all right, because I thought her.
All right. If everybody's all set, go ahead and take a seat. Does anybody want to practice some more and have me watch them? No. All right.
Yeah, I was questioning the fact that doing CPR is not oxygenating your blood.
So when you are so you're breathing now, and as you breathe, oxygen comes in, it doesn't come out. If you went into cardiac arrest, your lungs are filled with oxygen still. Unless if you weren't breathing for a long period of time before you went into cardiac arrest, which is rare.
Okay,
You're
so once
there's
you use that up, that's it.
yeah, you have about an 8-minute window. But even if unoxygenated blood going through the body can still do things. So hopefully we're there before 8 minutes, and we'll add that supplemental oxygen in. Give or take, everybody's different. So, but as you go down, you have oxygen in your blood. So that's why we start compressions, so we can move that blood through your lungs to get that oxygen throughout your body. But the problem we have with people doing breaths is they don't do it right, and they're not doing compressions. The breaths doesn't help if you're not doing good compressions. So
If we're out in the woods, we only have 8 minutes to get you guys there.
that's until the oxygen will run out. So there are going to be times where you're just not going to bring people back. So if there are people that have cardiac conditions, they probably shouldn't be in the middle of the woods somewhere without help. Unfortunately.
So someone with aortic aneurysm?
I'm not their doctor. I can't answer that completely. But if that's such a concern for them, they shouldn't be out that far. Yeah.
To be CPR certified, what additional?
It's between a 4 and 5 hour long course.
There's a lot more to it than just.
Yeah, we go way more in depth than all this. Yeah, this is more just kind of an introductory information.
So I've looked into like the Red Cross courses.
Yeah.
And yeah, they're long, but it seems like it's just professionals that go to those. Is
Nope.
it okay for like us to?
Yeah, absolutely. So there's different courses. So most of it, so that was a Red Cross video, but we do American Heart Association. So there's what's called lay rescuer CPR. So that's just kind of everybody can take that. And then there's more advanced courses that like we're required to take as professional responders. You guys wouldn't need that level of training, but there is just and this is the very bottom of the training where we're just kind of showing you the very basics on how to do compressions.
Because I haven't found the layperson one. Do you know where?
It's just so if you do American Heart Association, it's
All right.
I got it working. It's called Heart Saver CPR, and then basic life support is what the professionals would use.
Okay.
I don't remember the first cross or American Red Cross one. I don't remember what it's called.
It was like all professionals.
Yeah, but yeah, no. If you do American Heart Association regulates it all, and they do Heart Saver CPR is what it's called.
I'll remember that.
For the regular person?
If that's what you're looking for, yeah.
That's good.
American Heart Association. Either one, they both follow the same rules. Yeah. Yeah, not one's better than the other. We do American Heart Association, but the American Red Cross follows all the same guidelines.
Great, thanks.
Hold on 1 second. Let me just get everybody back to the seat. Is everybody ready to push on? You guys all set in the back? All right, let's have a seat and we'll talk some more. What's up?
I just want you to come over so I can see if the light comes on.
Yeah,
Where's the light at?
right here. It'll light up. It's right there.
Okay.
You push the light.
Is it coming on?
Push harder. Harder.
Harder.
Move your hand down that way a little bit. Right there. Now push hard. Harder. Keep going. Keep going. Keep going. Keep going. Push down hard. There you go. Hear
There you
that
go.
click?
Light come in.
Good job.
Wonderful.
All right. How'd everybody do?
Good.
Excellent. I walked around. I saw most people. I definitely missed a few. But overall, good job. And some people that were struggling on the table, that's fine. Once they moved to the ground, they did perfect, which is where we would want to do CPR. Today, we didn't do it due to space, and we all got bad knees, so why make them worse, right? But ideally, now we know, we want to try to get them to the floor as safely as possible. We don't want to cause more damage by dragging them off a ladder, a chair, whatever, and hurting them when they go down. So you always want to support their head. But again, remember, we have to do something. And that's kind of the theme of the day is something is better than nothing. So some people were struggling to go deep enough to get the lights on, and don't worry about the lights. Even if you're not going deep enough, if you're the only person doing it, you're doing something more than just standing there watching. Now, you may have struggled, but let's say someone like me who's not trained is standing right next to you. Could you now talk me into doing this type of CPR, and maybe I can go a little deeper? I'm a little heavier. I can push down a little harder. So now you know that. use everybody around you. Because unfortunately, in 2023, more people are apt to turn on their phone and record you as opposed to helping. Taking selfies and look what happened today. It's kind of the environment we live in. So, because if you just go on Google and YouTube, you can probably pull up somebody in cardiac arrest and people doing CPR. Someone's recording them instead of helping. So try to use the people around you. Call 911. If you don't feel comfortable calling 911 on your phone, tell someone to call 911. And be demanding of people. Point right at them. Go call 911. And then go get the AED. Because they're more apt to do that, as opposed to if you just say, someone call 911. You're going to see a bunch of phones come out, and then they're all going to be recording you while you're trying to do this. All right? A couple questions that came up. We have, how do we do this on children? So this course isn't about children and infants, but I'm going to give you some tips on that. So children and infants are treated a little bit differently, but so are people that are a little bit bigger, a little smaller. So with children, imagine this mannequin's a little bit smaller. If you feel like using two hands is too much, use one hand. And then when you get down into the infant range, you can use two fingers. And the anatomic locations are a little easier on babies. Just find their nipple line, take the top finger, whether it's this way or this way, to the nipple line and the other finger down, and you're just gonna press down as hard as you can, and same rate of compressions. And we're just doing compressions. All right, I don't have any infant mannequins or children mannequins today, but you just kind of scale it down to how big they are. Don't worry about ages. Don't worry about how much they weigh. It's based on how you can handle the compressions. So I may be able to do one hand on a child, but you may need to use two. Treat the patient as what you can do. All right? A couple other questions about AEDs. Was that your question? Oh, I'll get to you next. So AEDs. So we're not talking about AEDs too much today, but I'll just go in some real quick details on them. There is an AED here. The staff here, the full-time staff, almost all of them are trained in CPR with AED. So if anybody's interested in that and you want to talk to them, they can show you the AED if they feel comfortable. But the AED is supplemental to the compressions. A lot of people in the non-rescue world, non-professional world, hope the AED just solves all their problems. The AED is not going to solve your problems. It's not going to pay your bills. It's not going to get rid of your nosy neighbor. The AED, when it gets attached to the patient, is going to read a rhythm, and it's going to shock that rhythm if it's a shockable rhythm. There are heart rhythms that are not shockable. It'll tell you if that patient has a pulse, and it'll tell you to check the pulse. That's the time where you want to check a pulse. If you do shock the patient, we have to pretty much prime the pump. And what that means is if I haven't been doing compressions for a while, I slap the AED on, it's probably not going to want to do anything because I haven't been flowing blood through the body. Think of it like flushing a toilet with no water. Does that make sense? We got to pump the blood through the body, and then the AED will help with the electrical portion of the heart. And this isn't a whole class on AEDs, but the pads, they show you where to place them. One goes down here, one goes up here, so everybody can see. And it doesn't electrify the heart to start again, it stops the heart, in hopes that when it restarts again, it starts in a non-erratic or irregular rhythm. All right, but that's more for like the certification course. Really what we want to focus on today is just doing compressions.
So when would you use an AED?
So hopefully immediately. So if you know where an AED is, have somebody grab the AED, start compressions. Compressions, compressions, compressions. If someone else is putting the AED on, don't stop compressions to help them. Compressions is the one thing that is going to keep this person alive. The AED only helps that. If you stop while putting the AED on, it's probably not going to do anything. All right? So while you're doing compressions, someone else can apply the AED. The AED, like the one here, will tell you to stop doing compressions because it wants to read that rhythm. But until it tells you to do that, whoever's doing compressions does not stop. All right, good question. You had one in the back.
Is there a difference between adult, child, and infant with depth of compression?
There is. It is difficult to go into too much detail, but on the average adult, it's about 2 inches. Children, it's about 2 inches, and an infant is 1.5 inches. One thing we also use is the depth of their chest front to back in diameter. It's 1/3 from front to back. So if you have someone whose chest is all the way up here from the ground, 2 inches ain't gonna do much. So it's 1/3 the depth of their chest from front to back. So you could spend all day going into details on how to do it properly, or just do the best compressions you can do. And a question came up here, what if they have something wrong with them? Am I gonna hurt them by doing chest compressions? What did we learn today about that? Doesn't make a difference. Unfortunately, and this sounds sad, they're dead. And if you don't do anything, they're gonna stay dead. If they wake up and they say, wow, those chest compressions hurt me, go back to the first part of that statement. Wow, I'm alive and those chest compressions hurt me. Thank you. All right? Any other questions? Wow, none? So if there are no more questions, I do want to thank you today. And look at that, we did it in just under an hour. Good job. Thank you all for coming. I hope you never have to use this training. Unfortunately, this does happen a lot. I don't have any statistics to give you, but it happens often. As we get older, it becomes more common. So take care of yourselves. Be healthy. I want to thank LCAT for coming out today and recording us. Hopefully they do a lot of editing. This is very hard to do. And I don't think they're, and thanks to the Council on Aging for having this. Hopefully we can do this again. Did you guys feel this was good training? Yeah. Appreciate it. Thank you. Yeah. All right, you have a good day.